on the program, I have the founder of an initiative. It's called the C-Section Mom Initiative, and she also has a community on Instagram. It's called the Diary of a Niger CS Mom. I'm talking about Mrs. Oluwa Jeremy Adewale. Nice to have you on the program, ma'am.
Thank you very much.
Okay, so let's get straight into business today. April, we all know that April is dedicated to raising awareness on cesarean section. What's your take on the way this birth method is still being perceived in this part of the world?
Thank you so much for the opportunity. The fact is, cesarean section birth has been something that we do not really talk about in this part of the world, and most especially in Africa. We tend to look at it, if I'm going to say it in Yoruba, that Ọlọ́run má jẹ́ á rí nǹkan ṣe máa fọ̀bẹ gbẹ̀bí. So something like, God forbid that they use knife to bring out my baby, So this has been the ideology of everyone. No one wants a cesarean section birth, let alone talking about it. So it's something that is heartbreaking when you see a woman who needs a cesarean section birth, and because of what people will say, because of the way she will be perceived, she doesn't want to undergo a cesarean section birth. Apart from those who are just limited because of fund. But most people, 90% of people, do not want to have a cesarean section birth because of what people are going to say, and because of the perception of most people in Nigeria and in Africa as a whole.
Do you think it has to do with the fact that they consider the woman as a weak or a weakling?
It's one of the reasons. The first one is looking at the woman as a weakling, that she's unable to push her baby, and most times you hear other women especially telling you, oh, it's because she's lazy. That's why she cannot push the baby out. Okay. Then another reason is religion. We look at it as, oh, each woman was birthed like an Hebrew woman. And so they forget about what the Hebrew woman that is being mentioned in the scripture, what the Hebrew woman birth is all about. So the perception is in diverse ways. But most importantly, they look at the woman as being a weakling, and also she is not faithful enough to God, and that is why she cannot give birth through vagina.
And now that you talked about faith, what about even the religious houses?
I would say for those that have started, is a good thing, because to me and to everyone, what should be of most paramount is a healthy mother and a healthy child or children. So at that moment, those that are doing it, they are doing a fantastic job. And those that have not started, we need to educate them more, because some are ignorant of the benefits of cesarean section birth, while some are just blinded by religion. Because I do not see anywhere in the scripture where it's been mentioned that it is by this particular way that you must give birth. And if we talk about the Hebrew women, we already know that it was a lie, just to save those babies from the king at that moment. You understand? So with that, it is not about how you give birth. It's about you having a healthy baby and a healthy mother.
True. Now, you have a community called Diary of a Niger CS Mom, and some of the things that we see on your handle, you post different things. One recently was the fact that you were doing like a crowdfunding for a lady who delivered at the hospital. I want you to enlighten us. What are some of the things you do?
Okay, Diary of a Niger CS Mom is a community where we educate, and where we educate everyone, both male and female, about the cesarean section birth, and also supports women who need funds for a cesarean section birth. Most times we do not prepare for a cesarean section birth. Why? Because we, like I mentioned earlier on, everyone wants to give birth like the Hebrew woman. We want to have a vaginal birth. But there are some circumstances that will be beyond the control of the woman and the medical team. Sometimes it's because the woman has a small cervix, the cervix is not opening, maybe the pelvic is too small. There are some women that have the male pelvic. Now, with a male pelvic, the male pelvic cannot expand. So if a woman has such pelvic, then the woman cannot go through a vaginal delivery. Now, the woman will need a cesarean section birth. If the woman has high blood pressure, diabetes, and so many other reasons why she can go through a cesarean section birth. Now, when such happens, what needs to be done is a cesarean section birth. So what we do is, most times it ends in emergency cesarean section birth, whereby the woman or the family are not prepared for such birth. And so there is no money on ground to foot the bill. So what we do is we do a kind of funding for such women after we might have gotten our fact that truly she needs this money. So we'll make a crowdfunding, then we'll make a payment on behalf of the woman. We'll pay directly to the hospital, not giving it to the woman or to the family. So we'll pay directly to the hospital, then we'll get the receipts from the hospital. So that way she's okay and she's able to go home. So we help, apart from educating, we help get funds for those that genuinely need it. Okay, so like the woman you mentioned, she's a 27 years old Rita. Rita went to the hospital in February and she was rushed down from an hospital in Lakwe, that's after Aja, to LASUT, Lagos State University Teaching Hospital, on the 27th. And there they realized that she needed an emergency surgery, which was done immediately. But 2 days after, the baby passed on. But from that February 27th, she was not allowed to go home. After she was certified okay to go home, she was not allowed to go home because of the fee. So apparently the payment was huge. The husband could not pay because he himself does not even have a steady job. And she was a fuel station attendant who was earning less than 15,000 naira. So there was no way she could pay. So they paid 85,000 naira out of 325,000, which they were billed.
That's a laudable one. I also want to follow through on that. Different things happen to CS moms, women who give birth through cesarean section. One of the things you mentioned was that you do education, you do awareness, you also do crowdfunding sometimes. You also provide sort of emotional support sometimes, maybe through your posts or through the community you have to CS moms going through some psychological issues.
Yes. Now, for the emotional support, each mom that gives birth has opportunity to meet and some of the medical team that are in the community to help them get, we have postpartum depression. Now, there is postpartum depression, and we realize that most women go through postpartum depression. And when they go through postpartum depression, if care is not taken, it affects them a lot, which definitely will affect the baby.
Of course.
Okay, so after birth, apart from posting on the page, they have access to me one-on-one that will discuss whatever you might be going through, either before delivery or after delivery. Now, some people before delivery they are scared, they don't want to go through a cesarean section birth and things like that, and so they are unable to do anything, as in they don't have that opportunity to get the emotional support from their hospital.
Okay.
So what we do is they have the opportunity to speak with me, and we chat, and sometimes we see face to face. So we discuss about everything. Then after birth, we talk. They have access to tips on how to take care of themselves after delivery.
So what do you think that a community like yours, an NGO like yours, and other NGOs also pushing this awareness, what do you think you can do to make sure that religious organizations, to make sure that government agencies and families can help women to embrace this safer method of delivery as well, to save the lives of their babies and the lives of the mothers? What do you think you can do as an NGO together with other NGOs in this regard?
All right, thank you. One thing we can all do together, presently we go to government and private hospitals. to educate the women during antenatal classes. Presently, we are booked for like 20 hospitals to educate them on cesarean section birth. So because we know that nurses and other teams in charge of antenatal, they educate the pregnant women about vaginal birth, but do not educate them about cesarean section birth. So what we do is we educate them about cesarean section birth. And so what other organizations can do, religious bodies can also do, is to come together with us. Let's discuss why we train them on how to go about it. You don't just go and tell a woman you have to give birth by cesarean section. But what you can do is ways that you can help them understand why a cesarean section is necessary and is also a safe method. We train about that. Then they can also go out, like we have the religious bodies in church, maybe on Sunday or in their meetings with pregnant women and their husbands, even marriage counseling. They can discuss with them and teach them about cesarean section birth, so that at the end of the day, it doesn't come to, oh, in our family, that's from the man's side, in our family, nobody has ever gone for a cesarean section birth. It's only you. So I rebuke and reject it.
So it will now be like a family, saying that it's not a family tradition.
It's not our family tradition, and so because of that, you will not go through it. We've had in the past where a man says he is not going to sign, and the hospital said he needs to sign, and at the end of the day, the woman died.
I think talking about that again, I think those practices have been abolished, because I've seen cases where once the person that is supposed to be willed to the theater sign, does it still happen?
Presently, they can now sign, that the woman can sign by herself, if she is mentally and physically able to do that. The reason why most of them are after that is because of life and payments, so that if anything goes wrong, that is why most hospitals were doing that. But presently, like my fourth birth, I signed by myself even before my husband came around. So it can be signed, the woman can sign by herself now in most hospitals. The woman can sign by herself. I think that's an
awareness we need to push even further, to say that
yes,
the woman's life belongs to God and to her first.
To her, yes.
Okay. Now, just before we wrap up, do you have any activities planned for the year that you just want to touch on?
Yes, like for this month, we are still on our program touching the lives of C-section moms in the hospital. That's raising donations for them to bring them out of the hospital. For example, Rita is out of the hospital after spending 8 weeks in the hospital because of payment. We were also able to bring Faith and her baby home. That's 2 weeks ago.
Okay.
It's been 2 weeks. She's back home. Then we've also had the opportunity of helping a mom whom the husband told her to go and birth the way her mother gave birth to her, forgetting that she has a small pelvic and she cannot birth through the vagina. So we had to make payments for her delivery, because the doctor said it's not even a 50-50 chance if she goes for a vaginal delivery, knowing fully well that she has had a first cesarean section because of that small pelvic. So we are still searching for funds for other moms that are in mostly general hospitals and teaching hospitals that have not been allowed to go home because of their payments. Then we also have a program first week in May that we tagged Clothe a Mom or a Baby.
Okay.
It's a program to put smiles on the faces of moms and babies who need clothes, toys, shoes around Alimosho. So we'll be having that in Alimosho in the month of May.
Okay, that's interesting to know, and I wish you all the very best. Okay,
Thank
on the
you very
final
much.
note, a word to the mothers, to the fathers, to everyone listening to you right now, or will read the transcript of your interview right now, a word to them.
Thank you very much. I want to say that each mom is wonderful. each and every one of us, we are mothers. You are a mother, and as a mother, it does not matter your birthing method. What matters is that you birth with confidence, and that is our motto: birthing with confidence. Your confidence matters. When you have the confidence that you are able, you are enough. If you birth through the vagina, you are a super mom. If you birth through cesarean section, you are a super mom. No birthing method is easy. There is no easy way out. And so what matters is that we have a healthy baby and a healthy mother. To our husbands, to our fathers, we want to say, please support your woman in any birthing method she has to give birth through. It really matters a lot to them, because if the husband is not supportive, there is no way she can go through the pain, the discrimination, the talk, the side talks all alone. I have the support of my husband, and that really helped me a lot with my first cesarean section birth. Even when people talk a lot about me being lazy, me being wasting my husband's money and so many other things, but because he supported me and he told me, what matters to me is you are fine and baby is fine. So whatever anybody says, it does not matter. So that alone was able to help me, even though I was suicidal because of all the things I was hearing. But because he stood with me, and still standing with me makes it very easier for me to come out of my depressing state. And so please, fathers, husbands, support your wife, support the mother of your child and children, and let's make the world a better place. With a healthy mom, the babies will also be healthy and will be fine. Happiness will always be in a home when the woman is hale and hearty. Thank you.
That's a very good submission, and I hope that everyone will take up this mantle and ensure that the mother is alive during delivery and the baby or babies are alive during delivery. Thank you very much again, Mrs. Oluwa Jeremy Adewale. Thank you
Thank
very
you
much
for
for
having
speaking.
me.